Joel Hunt. I'm a PA and work at 4th Street Clinic in Salt Lake City, Utah. So I work at a homeless clinic. It's a not-for-profit, federally qualified health center. And we have about 60 employees, and we see homeless people, homeless defined as staying in shelters, literally homeless living on the streets, sidewalks, cars, shelters not meant for human habitation like sheds, garages, hotels even that don't have a kitchen, and changing places, and also people who maybe stay in homes, but it's a different home about every night. And we see them here in the full primary care setting with all paid staff, and then we have volunteer specialty physicians who come in and offer care as well. One of the things I noticed after working here not very long was that not all homeless people were accessing care in the clinic. And particularly, I noticed that it was often people with some of the greatest needs, physical health needs, mental illness, substance use disorders, were not accessing care here, and were kind of costly to society in resources, both human and financial resources. So I helped start a program to take health care to them in the form of street medicine. Street medicine, I didn't know that it had a name at the time, but it had been done a lot of other places, and it's defined as bringing health care, delivering health care to people in their reality, literally right where they are. And so that's what I do now. I'm the medical outreach director, and I spend 32 hours a week dedicated outside of the clinic. The other 8 hours are meant to be 2 4-hour blocks of time in clinic for those patients to be able, that I meet on the street, to come in and see me in a fixed facility to hopefully help bridge the gap of misusing other resources and get used to mainstream services where they can get better care and connected into more services. Homelessness in the United States is quite prevalent. It began as a real noticeable issue in the 80s after the decentralization of mental institutions of state hospitals. That's when we really noticed it becoming a big problem. And since that time, it's just gotten worse. One of the benefits of working in a homeless setting, and then particularly in a medical outreach, street medicine role, is being able to interface with so many different people, from the homeless patients themselves to state and federal legislators and educators and all kinds of different people. And the students have become a favorite of mine because I get to re-experience observing homelessness for the first time again. It's become something that I know quite well, from not experientially, but as a practitioner, and I've lost, I think, some of the newness and the stark contrast that somebody that's seeing it for the first time sees or experiences. And the students we take are nursing students, medical students, PA students, nurse practitioner students, social work students, undergraduate students. And I can remember there's been several impactful quotes. One of them was, we were finishing, almost pulling into the clinic, and he'd been fairly quiet throughout the time, just sort of taking it all in, I was hoping. And as we're pulling back in, he said, "Man, I just feel so much like a world citizen now, because I didn't even see these people before, and now I see them. I'm not going to be able to not see them, and their needs, and the complexity of their needs, and that it's not just a simple go get a job, go find a place to stay, and how interconnected their whole person is." And one of the things I try to get students to learn is the World Health Organization definition of health, is that it's not just the absence of good health, that it's a full, whole body well-being that is definition of health. And it is, I don't know in the United States that you get an experience to be able to see that so raw as you do as somebody that's homeless in their tent, in their camp, and on the sidewalk, and really understand that we may be able to meet some national markers for hypertension and diabetes, and we're really not impacting their person all that much. But neglecting to pay attention to those health care concerns is important. And so it's a very complex web of so many parts of the human person that it's not simple. And I think seeing that with students and helping walk them through that, again, is good for me, but also good for them. And you can just see the lights come on, and honestly, some of the fear of what if we can't fix that? What happens when we're faced with this situation and there's not something we can prescribe to make it better? And that is a reality that happens every day. And just being faced with that, and faced with the fact that we know a lot as a society of healthcare providers and the science, but understanding that we still our toolbox really isn't that big compared to the needs that this population that I work with, the needs that they have, and how much we rely on other agencies, other services that provide, again, back to the WHO definition of health, that provide those other aspects of full person health, is really one of the things that I love to pass on to students, that to think big and not just about the disease process that we're addressing at that time. I think in looking down the road in this niche that I work in, PAs, mid-level practitioners have this is a very great place for them because of our training, our fund of knowledge, our experience lends well to being on the street, being out of the clinic, taking healthcare delivery directly to people, and good quality care, having physician support and backup, both in the clinic, in the hospitals, and even out on the streets, maximizes their potential, their training, while also maximizing ours as mid-levels, and being able to go and see people right where they are, literally where they're at, and it's also very cost effective.